guys, this is Dr. Girmann with Inertia Medical, and today we're talking about carpal tunnel syndrome. I drew some anatomy on my hand here that we'll go over, but what is it? It's a condition that often causes numbness and tingling, pain in the wrist and fingers, and let's look at why that might occur. The nerve that's involved in carpal tunnel syndrome is the median nerve. Now this nerve travels down the forearm through the carpal tunnel and into the hand, where it provides movement for various muscles of the hand, particularly around the thumb, and also sensation to these 3.5 fingers. And you can see why that is, because it has these sensory branches that go to the thumb, the index finger, the middle finger, and half of the ring finger. So for that very reason, patients will often come in saying that I get numbness and tingling in that distribution. Sometimes I also have to shake my hand to wake it up. Now, the reason that all of that occurs is because there's excess pressure or compression on the nerve in the carpal tunnel. And this little white structure represents the transcarpal ligament that overlays the tendons and the nerve in that area and can often cause dysfunction. So let's look at the ultrasound, which tends to be very helpful for this condition. And what I'm demonstrating here is the nerve right in this location, which is surrounded by circular white tendons, which help to flex the fingers. So this is what we see when we're looking at the carpal tunnel with the ultrasound. Now, one of the ways in which we diagnose this condition, we can use the ultrasound because a nerve that is chronically compressed or it's squeezed on gets bigger. So if the nerve looks bigger on ultrasound, that's an indication to us that the patient might have this condition. Another way that we can diagnose it is by performing an EMG or electromyography, which is a nerve study to see how healthy that median nerve is. Now, when we start talking about treatment, there are a whole bunch of options. So we will commonly demonstrate specific exercises for the patient. In addition to that, we will often have them wear a wrist splint at night. And the reason for that is because when we sleep, we tend to bend our wrists, which can kink the nerve, cut off some of the blood supply, and worsen the symptoms. So this is an example of a wrist brace or splint that one might use. I just picked it up at a local drugstore, and I was having carpal tunnel symptoms a while ago. I'll get them on and off. And what I'll do is wear this at night. It helps to keep the wrist straight. And this, for me, when I wear it for a week or so, it gets rid of my symptoms. So this is one of the earliest treatments that we'll recommend. Beyond that, we can inject the carpal tunnel. We can put medication around the nerve. And that's where the ultrasound, again, becomes very useful. Let me show you a picture of one such injection on my computer here. If you zoom in, this is the median nerve, that's as it's labeled, and a needle can be directed very safely around that median nerve, where you can place anti-inflammatory and perhaps numbing medication. So that's another option. It tends to be quite successful for people. But if symptoms persist, despite these other treatments, there are more invasive techniques, like, for example, a carpal tunnel release, where the goal there is to essentially cut this white ligament to open the roof of that tunnel and give more space for the tendons and for that nerve. Now that can be done a couple of different ways. Classically, it would be done in an operating room where a surgeon, a hand surgeon, would cut that ligament. It's a very simple procedure. These days, we're actually able to do it under ultrasound, so you can perform a minimally invasive ultrasound-guided release, and maybe I'll link to a demonstration of that also. So lots of treatment options for this condition, carpal tunnel syndrome. It's also in the medical world called median mononeuropathy, which means there's a problem with the median nerve, and you can see why. So that's what we're talking about today. If you have any questions, send them our way, info@inertiamedical.com. Thanks a lot.